Okay.
7:31, May 9th, in the town of Fairfield, Board of Ed meeting is called to order.
Board of Health.
What did I say?
Board of Health meeting.
I said Board of Ed.
Board of Ed. Oh, I don't want to do that.
Yeah.
No, I definitely don't want to. Oh, my God.
That's okay.
Board of Ed, I'm on too many meetings, too many committees. The Board of Health meeting. So we have a quorum. So I guess the first thing is, did everybody receive the email for the minutes from last meeting? Anybody had any additions or corrections?
Only correction I have is just throughout the misspelling of my last name.
Okay.
Okay.
Just the I and the L first.
Okay. So L-I. Okay.
Jason, so do we have a motion to approve the minutes?
As amended.
So moved.
As amended. Second? Anyone?
Got to be Mary Frances or Chrissy. To second.
Okay. All in favor?
I don't think I can because I wasn't there last month.
Okay.
Okay.
We got our second.
So all in favor? Any opposed?
Aye.
No opposed, so the motion passes. So we can go to Sam's, your director's report.
Sure. So I'll do a quick COVID update. So at the U.S. level, the last 7 days, the CDC reported that they're about 20% up in cases over the previous 7 days, about 17% increase in hospitalizations, and about 9% increase in deaths. And this is largely due to the BA2.12 variant. That is the new variant that is rising now. Is about 45% of the cases is this new variant, and so at Connecticut, I mean at the county level, 88% of the counties in the country are still at a low level using the new community levels category. 10% are at medium, and 2% are at high. Unfortunately, the area in the country where that has the greatest concentration of high community level is the Northeast, where in Connecticut we have 3 counties that are now in the high level, and the remaining counties are in the medium. Fairfield County is in the medium. It's Hartford, New Haven, and Middlesex County are high at this point. But if you look at the CDC map, it's most of New York, the northern part of New York, and some Vermont, New Hampshire, Maine, Mass, Connecticut. It's kind of spreading down from the top, coming this way. For Fairfield, we've seen a gradual increase, and this is what the CDC kind of referenced as well today, is that it's not an exponential increase they're seeing. It's a gradual increase, but a steady increase. And we've seen that same thing going on for, an increasing trend for 9 weeks now in Fairfield of cases. And we have started to see a slight increase in hospitalizations and deaths, but not at significant rates. Just a gradual upturn. Right now, in terms of cases, we are seeing what's probably a little bit higher than is probably the second highest peak of all the waves of the pandemic so far. So the Omicron wave is by far the highest, and this one right now is looking like it just surpassed the wave back a year ago in the fall, in late fall and January a year ago, which was the second highest peak. Right now, for vaccination for Fairfield, we are at 84% with 1 dose, 77% fully vaccinated, and 47% with having received an additional dose. So some of the things that are coming up that are issues for the health department, some legislative changes. I don't know if I mentioned this before, but the lead poisoning prevention statutes were changed just recently, signed by the governor. So what they're doing is lowering the thresholds that are considered for a lead poisoned child. So right now, a blood lead level of 20 is what is what triggers a full environmental investigation. One test that's a blood level that's 20. What's happening is they're going to, over a period of 3 years, bring that down to where one blood level above 5 will trigger a full environmental investigation. So that means, and so it's going to be transitioned in. So right now, it's 1 above 20, or if you have two tests, blood lead tests above 15 that are further than 3 months apart, that triggers an environmental investigation. That same scenario is just going to kind of shift down for the next couple of years, where between 10 and 15, 2 tests 3 months apart, then that triggers, and then by January 2025, it will be basically one test above 5 will trigger a full environmental investigation. And so that involves, an inspector, someone who has their license in lead poisoning prevention and inspections will conduct a full comprehensive inspection of the dwelling where the child resides, do an epidemiological workup, identify the potential sources, and order a remediation. So the end result will be, some additional work for the sanitarian staff here, but also it'll be an impact on homeowners in Fairfield. So right now, like in the past, 20 years, we get, I would say every 3 to 5 years, we get a case, a single case where we respond to that. What this will change is essentially we will go from that till when this is all done, having 3 to 6 cases every year. And so it'll have some impact. The good thing is the state has indicated there's funding associated with it, so it's not an unfunded mandate, but it will, these costs are big. To do a lead remediation at a most of the homes in Fairfield are built before 1978, so most of them have lead paint. And when you do a lead remediation, you have to address everything, and so it can be very expensive, and so it'll be an impact on the town and the residents here. But it's it is for a good cause to prevent childhood lead poisoning, and so but it'll have an impact in terms of impact on the staff, additional demands upon them, and then and as well as homeowners. So I thought I would share that. And then in addition, the state is a couple of years ago passed, and did I share about itinerant vendors last time? I don't know if I did. I don't think so. I'm getting blank stares, so I'll say. So the state changed a law that basically said if you're an itinerant vendor, which is a food truck or a food cart, that going forward, they passed a law that said the Department of Public Health and local health departments shall put in place a system that allows an itinerant vendor to obtain one license from the town where their business is located, and that license shall be good in every other town. And so basically reciprocity throughout the state for itinerant vending. And so it's pretty tightly defined of, you go to one place and you park your vehicle there and you vend from there. So what the effect that'll have on Fairfield is we have, in the last couple of years, about 47 itinerant vendors that we license. Now, some of those about 13 of those are based in Fairfield. They, are people that live in town or operate out of their restaurant in town. And so we get an itinerant vendor license from them, and we inspect them regularly. And then the others, 30 plus others, are people that typically do like temporary fairs and festivals, or come to, Fairfield U hosts food trucks like one day a week. And so they choose whether they want to do a temporary event license if they're just coming for, there's a food truck event at Jennings Beach once a year. If they're just coming for that, they get a temporary event fee, $100, and they're covered. But if they're planning to come to Fairfield for 3 or 4 of those, they opt for an itinerant vending license from the town, which is $325 versus paying 3 or 4 individual ones. And so we're still unclear on how this will play out, but what it'll likely result in is some loss of revenue for the department, in the sense that we will probably lose some of those vendors, but there's also some lack of clarity on it, because what the state is telling us is that an itinerant vendor at a temporary event is acting as a temporary event, not an itinerant vendor. And so you can still charge a temporary event license. And so so it's complicated. This is how they're saying it's going to work. What I don't think, who knows that, is the itinerant vendors. And the other part about this is they say they still have to get all the other approvals required by a town. So, like, for example, in Fairfield, if you're an itinerant vendor in Fairfield, you have to get a vendor's license from the police department and have a background check done on you to make sure that you're, appropriate to be selling food to people throughout the streets. And so they still have to comply with all the other regulations, but it's for this particular program that we're entering into now, is this requirement that they don't have to get a health license. We can still inspect them. The state is having to create an entirely new inspection system online so that we can see the history and see when they were inspected and see how an itinerant vendor from another town performed. So the state's creating this whole new separate itinerant vendor licensing and inspection portal that we can see, which is yet to be shown to any of the local health departments. But so it'll be a challenging endeavor. The program being put in place is being called a pilot program for 3 years. We'll try it out and see how it goes. And they're giving towns the option to opt in or opt out by signing or not signing an MOU that indicates you're part of this. And obviously, there'll be pressure for every town to participate. And why are you not going along with the governor's initiative on this? And so, we obviously we have to answer for loss of revenue and how that will be adjusted. And in terms of we don't have a problem with promoting small business and making it easier for them. It's just making sure that it's done safely, because very often we go to these temporary events and they'll say something along the lines of, "Oh, well, we forgot to fill our water tank, so we can't wash our hands," and, "Oh, our refrigerator broke down and we can't." And so, fairly often at these events, we find vendors from other towns that are, not doing things as they should. And so we often have to tell them, sorry, you either go fix it and come back, or you can't be here. And so it'll present some new challenges. I think we'll probably see a lot of new vendors that we've never seen before, and hopefully the state system will enable us to do that. But as I shared in the email to you and to the first selectwoman, that it'll require a signature from either yourself or the first selectwoman to say, is the town opting in? And so it's something we can discuss here, to offer to the first selectwoman or to Mark, if the opinion of the board, if we should participate in that type of MOU at this point. My perspective is it's a pilot program. We should probably give it a try and be a part of the team to make it promote small business, and we'll work out the kinks as we go.
So is the state providing so it's a state program, so the states will provide, state of Connecticut will provide the inspectors to do,
No.
Is it uniform? I mean, so who's doing the inspection?
So all food inspectors in the state are standardized by the state. So there's training that goes along, and then to be a food inspector, you have to be standardized by a state inspector. And so in that way, the inspectors are standardized. In reality, inspections can vary from town to town, and from inspector to inspector. But no, the state will not be licensing the vendors. The state will not be inspecting the vendors. It'll all fall to local health, who does it now. So it's not additional work. It's just a little bit of a paradigm shift in how we do this. I think we'll be able to do it safely. We run a fairly strict ship here in terms of food safety in town, and so we will continue to do that. We try to be business friendly and work with establishments to get on the right track. And so we think we'll continue to do that with these vendors. But again, this is something that I would, appreciate the board's input and thought on, that we should move forward with either doing that or not doing it, and to give my guidance, or the first selectman, I can say, the Board of Health consider this and is of an opinion this way or that.
So I mean, for a temporary trial basis, I would say it's probably worth doing. I think from a town perspective, my concern would be we may now have a larger influx of these trucks coming to the town that perhaps now you'll need to be inspecting and may not have the manpower to do that if we have a large enough influx, because now they won't have to get the licenses.
Yes, that's.
So I look at it from that standpoint. Could this be detrimental to the town in that regard?
Yes.
But I think it's probably worth trialing.
The limiting factor on that will be the requirement for a police vendor's permit. So a vendor showing up, for example, we don't have, while we have staff on the weekends to do fairs and festivals and things like that, we don't have staff driving around town looking for itinerant vendors on the weekend. But the police are driving around. If the police see somebody that they don't have on their list as an approved vendor, the police can scoot them out of town or say, okay, you got to come back on Monday and get we have to do our due diligence with you and to approve you, and they will, but the police will be able to scoot people out of town that they don't have on their list.
And does every town have a very similar process with the police department? This way, something that they're probably used to, or not necessarily?
A lot of them do, I've heard, and some of them have zoning requirements, that you have to get a sign-off from zoning as well. Ours is really, you just have to talk to zoning and understand, like, hey, you can't take up parking spaces for, and if you park on a town street, you have to abide by the parking regulations. So if it's 2 hours, you got to move in 2 hours, and if you park in a commercial lot, which some of them do, you can't reduce the parking available for those businesses, and so sometimes there's restrictions on that. And so just getting them to understand what they're allowed to do, and
So it's really a matter of trusting that inspectors from other towns. So if somebody comes from Torrington, say, or a town that's further away, they know that the population here is more. They can have an event here. They're inspected by their local health department, so they can take their truck, bring it down to Fairfield. The police department is more logistics and making sure that they're following the rules.
Yeah.
But we're not duplicating. In other words, they have their, in terms of the food safety, that's already done. That's accomplished by their own town.
So the initial inspection will be done, and the licensure will be done in where their base of operations is, however they determine that,
right.
Whether that be where their vehicle is registered, the town that the vehicle is registered in, or, for example, in Fairfield, we have restaurants that own trucks, Bodega and Super Duper Weenie. They own trucks, and they, are based out of their business. They may not live in Fairfield, but
right.
But every health department that truck goes to vend at, those health departments have the right to do an inspection. So they will be inspected multiple times, most likely, and if the state does what they're saying they will do, we will have a database to say, okay, hey, listen, this place always gets 98s, 99s, 100s and their inspections, and they were inspected 5 times in the last month. We don't have to worry about them. Maybe we'll take a quick look, but they've already been inspected, and that's the whole intent, is to have this base of knowledge to say, here's ones we need to watch out for, and here's ones we don't have to worry so much about. So.
I think part of the rationale is just to be more small business friendly, instead of having to obtain 3, 4, 5 permits, obtain one.
Yep. Yep.
How much revenue do these licenses bring in? Like, if it's a potential revenue loss,
I think it's
worst case scenario.
$350.
I mean,
Yeah, so the itinerant vendors, or the full itinerant vendors, so if you're based in Fairfield and you park on the streets in Fairfield, that's $325 or $330 right now. Went up, I think, recently. But what it's hard to determine is, and we've been trying to figure out what's the potential revenue loss on this.
mm-hmm.
With the the state saying, with the state saying that you can still charge for temporary events, if that plays out like they're saying, then we may not lose any revenue.
Right, no, I just mean it's the worst case scenario, if it goes to zero, like how much did we bring in on these last year? Like worst case.
Around 11.
I don't know if
Well,
it's
I
30
don't know
of them,
what- how
100
you
of them, oh, I
calculating
know there's
that.
500 of them, I don't know.
The 34 that are out of town, and the vendor fee is $350.
So, but those 34 are a mix of, it's a mix of temporary event, and so it's
Right.
I'd have to, I'd have to run a report in our munis system to know exactly how much. But it's if you take, they say there's 40 in town, and it's on the average it's $200 a pop, so it's $8,000 is a ballpark on what it brings in.
Right, but even if it was 34 at 350.
About ready.
Like, honestly, you could have told me 50,000, you could have said 500,000,
Yeah.
I had no idea.
In the scope of the town budget, it's not a big thing. Even in the scope of the health department budget, it's not a big thing, but it's, long learned, anytime it's about money, be upfront about it and say, I think we may lose some money from this, but it promotes small business, so maybe we'll get more people coming to town, more temporary event vendors, and so maybe that'll, maybe it'll surprise us and we'll be revenue neutral, but it has a potential for that. But it won't break the bank. So if there's any other questions, I'd be happy to get them. If I could get like a sense of the body vote of, to make a motion of somebody to make a motion that, the Board of Health is in favor of signing off on this MOU and doing the pilot program.
I mean, I personally think that I think that it's worthwhile giving it a go. I think I'm in favor. I don't know if anybody has any strong objections for.
I mean, going to a lot of events with food trucks and knowing people have started food trucks, it's obviously like a really big upfront investment, and getting to places where you can actually sell what you need to sell and actually be successful and bring in the income. I think the fewer barriers for that, because they've already put up like such a significant investment. I mean, I'm definitely would be in favor for I guess relaxing that, and certainly something that the pilot program allows that to just be assessed, in that context, and then move forward another year. I would say the only thing that might get a little bit funny or competitive is like, sometimes maybe there's like a preference to the people who are, if there is a limited number, for example, of food trucks at a particular, let's say at that event, right, where maybe there is a little bit of a preference then to, if it's an in-town event, right, that you have the people who have paid the permanent, like, in-town fees, like, so that other people with temporary couldn't necessarily swoop in and take those spots from people who are more established, participants in the town and in the system. You know what I mean? Like,
Sure.
I'm thinking of like, super, like we said, Super Duper Rainy, Christoph Crepes, places that are fire engine pizza trucks that are like kind of right on the brink of it, and then somebody comes from New Haven. You know what I mean?
Yep. So the two things I would say to that is, first, we already do that. We don't charge like anybody who has a license with us.
Yeah.
We don't, whether it be an itinerant vendor or a full establishment in town, we don't charge them temporary fees to do a temporary event. So in that sense, we try to promote, hey, hire local people, bring in local people, and we don't charge any extra fees.
They can already just do it.
So they don't have to get another license. They're already licensed in town. We know their business. We know how they operate, and they can just do temporary events. So in that way, we give them preference, but we don't organize any of these fairs and festivals, so we don't really have the authority to dictate who participates. Usually it's, a lot of times it's word of mouth. Oh, I tried this one, or I saw that one, or I went to this, and I wanted to bring these unique ones in.
So I could imagine just from an education standpoint, just educating that because there's like a slight change, it might be a different level of interest with different or more participants, that those who are in town, maybe they just let them know kind of first so that they could, put in their interest. I mean, and I'm talking about something where there's like a limit of, if they decide at the beach, there's only 20 vendors, for example, That's all.
Okay. So if I could get someone to make a motion that's in favor of that, and a second and a vote, and then I can...
I move that we endorse support of the pilot program.
Okay.
And
I'll second that.
And so all in favor?
All right.
Any opposed?
Aye.
You're good with it, Mary Frances?
Yeah, I was in favor. Sorry, I kind of hit the mute too late.
Oh, that's good. So at least I can bring it to the first selectwoman and express that to her, and depending on who they choose to sign it, you have the support of the board.
Yes.
All right, so that was the, that change going on, and then the budget was approved by the RTM, no changes to the health department budget, so we'll move forward with our budget relatively intact. I mean, I only shifted a few $1,000s from one of our own line items to a different line item just to cover sort of spending patterns over the last couple years. The town did participate in a Region 1, which is Lower Fairfield County all along the coast, tabletop exercise on the 28th, an anthrax tabletop exercise where we had every town in Region 1 represented with police, fire, and health department up at SHU West Campus in the guest house there. And we had a 4-hour-long tabletop exercise where we presented different scenarios and worked through, planning phases of responding to an anthrax event. And some of the facilitators were actually responders to the Adelie Lundgren incident. She was someone who received a tainted letter from one of the mail facilities and passed away from that, and the mobile hospital from the Department of Public Health is named after her. But we actually had some of the responders to that event participating as the facilitators for the exercise. So it was a very good exercise. We do these from time to time. Last time we did one, we did a full-scale one in 2015 where we actually ran cars through and set up tents down at Jennings Beach and ran, a few hundred cars through and dispensed sample bottles of antibiotics and did the whole thing, having people fill out the labels. And, so it's a learning experience. And so we've, been busy with a few other things, since then. And so now we're moving back into exercises and trainings. But it was good. It was good to get everybody back together. And I will just end it off with, and I don't know if anybody saw it, but I did a little segment on Channel 12 that was on the news last Friday for tick awareness and preventing tick-borne diseases. And so we got featured on the news in a variety of segments throughout the day. So it was good to get it out there.
Yeah, that's great. It's the right time for sure.
And my wife asked me, so what do you think when you see yourself on TV? And I said, I always think, do I look like that? Is that how I look? And why do I use my hands so much to talk?
It's great that you did that. That's fantastic.
So, and that's my report for tonight.
Thank you, Dan. Jill, I'm anxious to
Sure.
see what you brought in.
Oh, God. The nurses union settled their contract with the town, and it was approved unanimously by the RTM. I have not gotten a signed copy of it yet. I do expect some movement in the staff after that. Some people may want to reconsider retiring at this point. I hope not. I'm very happy with our staff, but we'll see. We'll see what happens. We're actively filling whatever vacancies we have, and we'll continue to do so over the summer, providing orientations prior to the start of the school. COVID reported cases to the school are averaging about 20 a day since our April break. Today we had over 80 cases reported to the schools, but that also reflects the weekend results. Between February 28th and April break, we were averaging a little over one cluster a week, which we kind of identified as 5 students in the classroom. Just in the elementary schools, though, it's a little difficult to identify. It's very difficult to identify clusters in the high schools or in the middle schools. Once identified, we report those results to the state DPH. We send letters home describing the situation, and along with test kits, and we recommend at-home testing. We don't require it, but we strongly recommend it. There have been no really significant findings in any of the cluster cases after the notification was done. There have been 3 clusters reported in the school since our April break. The first week back, we had none. There was no time for any transmission. There was 1 last week at Dwight and 2 today at Riverfield and North Stratfield. North Stratfield is a little bit different. It was really a very high number of cases throughout the school. We had our eyes on it since last week. They had a drama production. A few cases related to the drama production, but it really didn't reach that level. Today, it certainly did. So we actually sent a letter home to the entire school with test kits for the entire school. They got them out of storage, and one of our nurses from the health department went up and helped with distribution up there. Generally speaking, when the nurses or our department have spoken to the families of these positive students, reported symptoms are very mild in nature, and although there have been a handful of not even a handful, in which the family sought care in the ER, we're not aware of any hospital admissions among students. And that's it for COVID. It's really, just keeping our eye on it. In another unrelated matter, we've been working on getting an amendment added to the state legislation that was before the state senate last week to add nasal glucagon. And Mark, I think I spoke to you about this. To the list of medications that coaches and trainers can administer to student athletes. Glucagon, I'm not so sure all of us are aware of it, but it's used to correct severe hypoglycemia in individuals with insulin-dependent type 1 diabetes. Individuals who are experiencing this are unresponsive and they depend on others to administer the medication. Current legislation only addresses intramuscular preparation of glucagon, and that's not even allowed to be administered by trainers or coaches. And it involves, I'm sure some of you know, reconstitution, needles, syringes, diluent, and a lot of room for error. The nasal, this Baqsimi, the nasal glucagon, just comes like this. All you have to do is in one nostril, push it in, and you get the administration. It's a powder, and it gets absorbed in by the nasal mucosa. It's safe, effective, fast, convenient, and certainly much less intimidating for coaches and trainers to administer. So we've been in touch with Fairfield state legislators, the state Senate leadership team, the lieutenant governor. We've requested floor amendments to be added to existing legislation that was up for a vote. We spoke to the Juvenile Diabetes Research Foundation. We spoke to Lilly, the manufacturer of nasal glucagon. We've had lobbyists contact the Senate leadership team. That we've contacted the State School Nurses Association, and just about everybody I could think of. I gave testimony last month to a Senate subcommittee, as did a parent with who I'm working with very closely on moving this forward. Unfortunately, the legislative session closed last week, and we didn't get anything done. I've spoken to a few of our representatives, and they've promised that, it was just too much, too late, too soon, couldn't do it, but they've promised helping us move it forward next year. If any of you have had any experience with this, I just kind of dove in and spoke to anybody that I could, but if you have any experience in presenting anything to our legislators, I'd love to hear your experience, see how we can.
So actually, I'm very familiar with it.
Oh, good.
From a professional standpoint, I'm the legislative chair for the PA Academy in Connecticut.
Uh-huh.
And so actually, I know which bill you're speaking about, because it's the same one that enacted Narcan use. It was actually
That's exactly it. I really wanted to it was a bill about the administration of medications, and I really wanted to piggyback on
They weren't going to amend that at all. So actually, the glucagon section and the anti-epileptic section both neglect to mention PAs as able to order those medications. It doesn't mean that we don't necessarily, but it provides some doubt as to our abilities.
Yeah.
When administrators are looking and saying, okay, who can authorize these medications? So I wanted to amend that same bill actually to include PAs, because we were included elsewhere in that bill, but not in those two particular sections. And it's a very trialing process. We have a lobbyist, and, we have legislators that we speak to, and it's not an easy thing to do, so I commend all the effort that you put into that, because you really made, some really strong efforts to do that, but especially at the end, it can be really hard to amend some of those bills. Start as early as you can, start now. This way it can be raised again during the off-season by the Public Health Committee with the inclusions that you want. And I'd be happy to work with you further, try to get PAs included and the intranasal version included, and try to get it all done in one shot, because I think both those aspects are very important to our children.
And now the FDA nasal epinephrine is now on the market. I can't say on the market. It's being up for approval for the FDA, so that needs to be included in that as well. To have non-medical staff administer these things with syringes and needles, and if you could just do it with a powder,
Easy as
so much easier.
I think that there's no downside to having the nasal glucagon. When you give glucagon to somebody with diabetes, and it's totally life-saving, and they've got to do this. I mean, I didn't know that it existed. I know glucagon for sure, but the fact that it's been approved and it's been out.
So it's been out for a couple of years,
Yeah, I didn't even.
The thing with it is the legislation was last approved, voted on, whatever, in 2018, and this came out in 2019.
Right.
And as Sam says, we've been a little occupied since then.
Yeah.
But New York State, they made an amendment. They had a very similar setup, and they did a freestanding amendment last September. So there is some language in there that we might be able to talk to the Commissioner of Public Health and the Commissioner of Education and get approval just from them and kind of bypass all that, but I haven't pursued that yet.
And there's really an issue in terms of PAs being able to prescribe it.
I mean, in reality, maybe not so much, but from a statutory standpoint, PAs are regulated. It says physicians and APRNs, but not PAs in regard to those two specific medications in school administration.
So that has to be changed. That has to be changed also.
Yeah.
Yeah.
Well, I'd love to work with you more on that,
absolutely.
Jason. That'd be great. And just an update on the Narcan training situation. I think the last time I was here, we had one session done, and since then, we had a session, originally at Ludlow High, and then we did another one at Ward High. We got most of the interested parties from the public schools in there, and then we just did another one, was it last week? I guess it was, at Prep, and they hosted one for us and had a huge turnout there, as well as staff from Notre Dame and anybody else from the public schools who couldn't make the previous two sessions. So we have a lot of Narcan out there available to, the trained staff to access in the event that it's needed. Really great training was provided by the fire training school, the guys down there, so it's quite good.
That's great. Where is it stored within the school so they have easy access to it? Is it with an AED close by?
Yes, it's an AED.
That's great.
And the custodians check it every day, and their instruction, they always check the AED every day. Their instructions are to notify me or notify the school nurse if the Narcan's missing, and then we'll just replace it. But Greenwich has been doing that for a while, for a couple of years, and they haven't had any issue. Nothing's gone missing. So, and it's not, the drug is virtually inactive if you're not overdosing, so it's no risk of any harm. And then finally, I just want to say that Wednesday, May 11th, is National School Nurses Day, and I want to publicly thank, to make sure who's ever on the line, I want to publicly thank the school nurses of Fairfield for all they've done and continue to do for our students every day. They've clearly gone above and beyond their usual duties and responsibilities since the pandemic began. However, they have also never lost their sight of their role in the schools as care providers, communicators, educators, and most importantly, as advocates for their students. I did have a huge banner made up, and it was supposed to be hung up in Sherman Green, and it's not there. It was supposed to be hung up today. So I'll make sure that gets,
It's so windy today. I could be insane outside.
Just in there hanging
They couldn't explain it when I called. So, well, I just encourage everybody who's here and everybody who's listening on the call to thank their school nurses this week for all the care they provide to our students.
I can say from experience, Jeanette Buckley at Holland Hill does a great job over there. My son has seen her plenty of times this year.
Aw,
After
that's
many falls on the
great.
playground.
Jason, I'll be sure to mention that to her tomorrow.
Absolutely.
Excellent, that is great. Thank you very much.
I do have a follow-up question. Okay, so the one thing, it's kind of a statement / question, but the one thing that I still find like a little bit concerning is because somebody actually did send me a copy of that letter that went out to North Stratfield, and I think my question is what is the plan with that? What are we really hoping to achieve? Because again, we're at a point right now where I thought we had kind of moved away a little bit from perseverating on the case side of things, you know, just given the recent trajectories as far as hospitalizations, you know, more serious illness, the fact that that's not really happening still in the population, in the school population. So to me, you know, just given everything else that's going around, because I've heard there's a lot of flu, influenza A, there are obviously a lot of other viruses going around. The fact that we're kind of highlighting COVID still, it seems a little bit alarmist to me because we know in that population it's not having a severe effect. So I just don't totally understand why that's going out. I mean, there are other school systems that have completely eliminated even sending out those daily numbers of cases. They've, you know, eliminated that a couple months ago, and so we're still doing that. So I thought we were kind of moving a little more towards the if you're sick, stay home. If you're not, you know, and I also am very concerned about if all of a sudden it's being associated with, oh my gosh, now we have a few extra cases because of this drama production that occurred. You know, I mean, we, again, back to what we've seen with the mental health piece, with the suicide piece, with all of these things that were taken away. We know that drama, we know that music, we know that all of these performances are such an important part of these kids' experiences in school and in their mental health piece, because we now have that major crisis going on. I mean, there have been New York Times articles like every single day, basically, and well-known publications. So I just feel like we need to be really cautious not to have an alarmist attitude or people getting back to, oh my gosh, we need to test. I mean, what are we testing for? I mean, a positive case, but it's a positive case that we know isn't necessarily going to be a severe case for a hospitalization because there's not the data to support that in this population, you know? So why are we doing it? You know what I mean? Some of this is rhetorical kind of, but I just think we should continue to look at that because I think sometimes we still have the negative connotation that COVID-19 rightly had in different phases of the pandemic, and now we need to kind of transition away from that to a certain extent into, you know, the pandemic, to the endemic, to the just like this is something that we are living with, you know, and I mean, there's people now who are obviously vaccinated. I mean, I just looked up the numbers, 30% of the hospitalization, only 30% of the hospitalizations are unvaccinated, you know, so that's 60% of the hospitalizations in Connecticut are the fully vaccinated patients. I mean, there's just been such a transition of information and how COVID has evolved in the population, and certainly I know multiple people who have gotten it multiple times now. You know, I mean, it's here to stay. It's just here to stay, right? So and again, I know that's a long ramble, but again, that's kind of my question. Me personally, I don't think this is that helpful, because I mean, if I got it, I would say, okay, my kids aren't sick, I'm not doing this. I mean, I'm not testing them. I'm not gonna test them. I'm not gonna send them to school with a mask because they already had COVID, and I'm not worried about it. And I definitely would have been irritated if that came right after my kid's drama performance, because that was really important to them. And you know what? I wouldn't mind if one of them got sick for the sake of doing a drama performance, you know? Because that is that risk-benefit analysis that we all have to do as parents. And I'm very happy for one of them to get it, because every time there's a drama performance or dance performance or anything where kids are in close quarters, guess what happens? People get sick. It might be stomach bugs. It might be cold. It might be flu. It might be, you know, it just happens every year with anything like that where people are in, you know, an intensive group of people working together, you know? So I just have an issue a little bit with like kind of the negative connotation surrounding it. And I think we should be a little bit cautious about that. So that's my 2 cents, more than 2 cents. That's my.
And I'll just respond to that, you know, because I totally get that. But again, we are transitioning to approach COVID like we do other diseases. So at times when there's a lot of absenteeism due to flu, we send letters out to the schools saying, we want to make you aware.
Okay.
Because there's other people that can't get vaccinated or don't want to get vaccinated that would respond to that letter and say, okay, maybe I'll take some different protective steps. And we're trying to honor everybody in this and just make them aware. We're not requiring anything. We're not, there's no exclusionary practices. We're just making people aware of something that's going on. And that's at the core of public health. And what we do is try to prevent disease transmission, even mild disease. We try to prevent people from getting sick because nobody wants to get sick. And so we're trying to treat this similar to what we do with other diseases, that when things happen in the schools, we send out letters and make people aware of that. In this case, we just happen to have state-provided free test kits that we are going to expire.
Yeah.
And so we might as well use them and so send them out. And so that would be, I agree with you in some cases. We're not trying to be alarmist. We're just trying to make people aware, because some people might want to know.
Yeah, I just imagine it like, oh my gosh, COVID is really,
I don't think there's been no suggestion about taking away performances and music or anything that you mentioned, and I think that is right. That's the right way to approach it.
Right, I mean, it's just like a little bit of a blame.
That's true. We did not consider.
Right, but
there is that goes around sometimes like,
for the same, same reason that in all the hospitals, we're still masking, and in my office, we made a decision that we're still masking. People are vulnerable. We can hear sick patients. So, again, the schools are different, but if we make people aware, as Sam said, just because it's our community. So we just want, if there's any way for people to just be aware of what they should be doing if their child, even they get to that, whether their kid is really sick, they're coughing, they probably should stay home for a couple of days, until they're better. I think it's just more of an information. I think I agree. We don't want anybody to be alarmist about this, because we do know that we're towards the end of it. We're almost there, but we just want to. I think it's important that the health department continues to sort of provide knowledge for the population. So if there's a big cluster at an elementary school, to let the other members, the other parents of those kids who are at that school know about it.
Yeah,
that makes sense.
Okay, thank you.
Okay, was there any communications from?
I did not receive any.
No communications. All right, so no communications. Was there any old business or unfinished business that
we have nothing on the agenda? No.
Is there any new business?
We do have a new business. And so Jill is going to present on, I think I shared it with you, the revised vision screening policy for your consideration.
Okay, so what I'd like to do is propose a change to our policy and procedures that addresses vision screening. Automatic vision screeners were recently approved for vision screening purposes by the state legislature and have been widely used in schools, clinics, pediatricians' offices all over. SANS facilitated the purchase of the Spot Vision Screener, and I, for one, am really pleased and excited to make that change. I just want to give you some background on this, okay? The Spot Vision Screener is a handheld portable device. Would you like to take a look, everyone?
We're showing off our new toy.
Yeah, definitely.
he hasn't gotten the optional holster yet for it.
Yeah, wear that on your waist.
Yeah.
This is, I'm going to have this on my wrist forever whenever we use it, because I am so afraid of dropping this thing, I can't tell you. So it's a, where am I? Okay, handheld portable device designed to help quickly and very easily detect vision problems on patients as young as 6 months. If you have younger children, I'm sure that you may have had it in the past couple of years at the doctor's office, but we're only going to use it on individuals 3 years of age and up. The Spot Vision Screener, I should turn it on because it does take a while to warm up. The Spot Vision Screener automatically captures an image from a non-invasive 3-foot distance, and we're going to actually try it out. It uses a visual target and sounds in the machine to get the kid's attention and to focus in on it. It screens for hyperopia, myopia, astigmatism, and strabismus, among others. A number of these conditions are considered risk factors for amblyopia, often referred to as lazy or wandering eye, and it can cause partial or full blindness if not treated. Amblyopia generally develops from birth up to age 7, which is when we screen our students, and is the leading cause of decreased vision among children. So the Spot Vision Screener goes way beyond the old Snellen chart, you know, the EDEF memorized. Or, you know, this one, the illiterate one. It goes way beyond the Snellen or the E-chart, which provided a simple measure of visual acuity. The Spot Vision Screener is an objective assessment. There is no input from the child whatsoever. They just stare, and we get the information from them. It's a objective assessment of these visual abnormalities, does not rely on the child's input, verbal or cognitive abilities in order to get a complete screening. The screen displays the instant results, indicating whether measurements are in range or if a complete eye exam is needed. Results are easy to interpret and share with parents and eye care specialists. Not only is the testing procedure quick and efficient, so is the recording process. We can upload class lists from Infinite Campus, have the children sit on a row, and we did it a couple of years ago when we borrowed this machine, and just have their results automatically generated into a spreadsheet. And I don't think that IC allows for it to be uploaded from there into the child's individual records, but we're going to look into that. So we did a few classes a couple of years ago. When we gave providers the abnormal results, they were thrilled with it. We had one ophthalmologist offer, $500 toward the purchase of this, but that only covers a very small portion of the machine.
Did you give him a call now?
No, I didn't. Oh, sorry, Sam. So it just provides so much more information than the Snellen chart ever could. When we take a look at the procedure, it was a lot of information in the existing protocol that we had. And a lot of it was just, measure 20 feet, put their feet on the tape and all that. And we just felt it was unnecessary. So I really wanted to just streamline our policy into these yellow highlighted areas. I eliminated a lot of the procedures, put them into links in there. So we can just do a first read on this if you guys don't want to vote on it tonight, but I'm happy for anything that you choose, really. I think the links are a better approach, as these procedural bits are determined by the manufacturer or the state, and updates can be linked and updated automatically. The policy I wanted to include has information on the rationale for screening, the methodology, communication, and recording obligations that we have. And those need to be very specific according to legislative guidelines. So we wanted to just present a consistent approach to the screening. So who wants to get their eyes examined?
I could be the guinea pig. I'm due for an exam anyway. This would be funny.
So.
And does it matter if somebody has, for example, I have contacts, does it matter?
Yeah, you can't wear lenses.
Okay, so any sort of.
Sorry?
Anything that's either in the eye or
in
over
the eye of it. You
What company, is it just one company that makes that?
No, there are two, and two were approved by the state to use, but this is one that we are familiar with, and it's Welch Allen. So, We have our friendly little girl there. You can download everything, but for now, we're just going to say that Andrea is between 20 and 100 years old. Everybody's hearing the noise and the lights and all this sort of business. I'm probably going to time out. You stand 3 to 6 feet from her.
And does that matter?
Sorry?
Bless you. Is there
You did it.
Okay.
All right.
Is there like a height, or does it show
What
you how to
happens-
line it?
Yeah, I mean, you get a visual of her eyes.
Okay, so you
And
know
then
where
you
to put
see the
it.
clock going around, and then you know you're on board.
Yeah,
So
tells
here
you
are
when you're in the right zone.
those are all the results.
You should have her see if it matches her prescription.
I know.
How do
Like,
we do
can I
that?
take a picture of the result? Or is
Yeah, you can.
That would be great.
Remarkable.
Yeah, you have
I'll
pretty
say
good
from a
eyes.
personal
though.
standpoint, I think this is a great
Yeah,
activity
they're
for the town.
mild.
When my son was 3, they did this at his pediatrician's office,
Okay.
and it caught the fact that he actually had a deficit in his right eye.
Love it.
When I found out he had a cataract that had been missed, and he subsequently had surgery and lens replacement and everything.
Wow.
Yeah, so I mean,
Wow.
not common to have a
Are you
cataract
saying that they
Fascinating.
use this?
from that.
Yeah.
Well, the other good thing is that, for kids with special needs who aren't able to necessarily name things, you know, like a more
Exactly,
traditional
yeah, if they're not
style.
verbal, we're not gonna, and
Exactly.
so many
that
times,
it
you know,
catches
when we
so
were
many
over
things that-
at, when we had Giant Steps in town, but of
Yeah.
course now those kids are, a lot of them are integrated into the SPS. We would just have to say unable to test, and we were
Right.
sending home all those notices, and
Right.
that's not very satisfactory. They have this, and, really something you can start working on.
Yeah.
And you saw how quick it is.
Oh, it's great.
Yeah.
It's
Just
way
a big
better.
step forward in quality for our program, you know, like.
Oh, absolutely.
Just providing a better resource.
Wow, the technology involved is extraordinary.
But what you can do is go from this kid to that kid.
Okay.
It's like taking your school photo real
And-
quick, even faster.
You know how it is. When we would go in there, we'd have 20 kids line up, and they're out of class for, you know, a half hour.
The one thing I mentioned is that covered by
Hello,
the
Jill?
state, or like a grant through the department, or through how is that funded? And there's one per just school system, or?
Oh, one for the school.
Yeah.
School.
No, one is for the school district.
District.
And this is gonna be staying in my office and go around as they schedule their screening.
Got it.
Well, I think there's a question online.
Oh, go ahead.
Oh, hey, Jill, it's Henry. I just wanted to let you know that in Stanford, we have several of the units that we circulate throughout the district, and the nurses have been very satisfied in terms of the convenience and the ease of use.
I would say, Henry, that sounds like bragging.
Yeah.
Yeah.
Henry, you didn't know that you were just like creeping on the meeting here.
You've been on all of them, I think.
Henry,
Just lurking.
You can't stay away.
Henry, remember the first meeting you and I were together at, and you really, you know, told me how I had to streamline my policies and procedures? What I'm presenting tonight is the result of that discussion we had.
The Unifect.
And how did Stanford manage to cover the cost of several of the machines?
Kiwanis.
Really?
Oh, really?
I was
Yep.
gonna say there has to be a grant that would cover this, if you look in the right spot, you know?
I thought that I had asked them, to tell you the truth, in years past.
Going forward, we can, you know, if we want to be like
If I drop
Stanford,
this one,
we want to be like Stanford and get
I'll go get
several.
another, yeah.
You know,
The pediatric ophthalmologists I assume, are totally on board.
Oh,
with
absolutely,
this.
yeah, they really love it.
That's great.
Because not all the kids come in
Right.
every year.
Yeah.
And we can, you know, we usually had to wait till springtime for ECC when all those 3-year-olds turned 4, because that was the state mandate. But now, we're going to vote on letting them get tested at 3 years of age, because we can.
Well, so, very related to that, you know, the state doesn't require for some reason second graders.
That's right.
Which seems very odd to omit that one particular grade. But so why can't we do better as a town and include the second graders? Because, I mean, eyes change so rapidly at that age. To potentially skip 2 years really could put a child quite behind without it being realized, because they're not doing this at the pediatrician at that age either.
Right.
As far as I know, I think it's just 3 and that's it.
You know what, that's probably a result of years back, a 3rd grade physical was required, and they got rid of that, and then they, presumably the child's vision would be checked for that 3rd grade physical, going into 3rd grade during 2nd grade, but we can certainly include it. I mean,
If it's not too much more of a workload requirement for.
Not now.
For every year.
I think adding second grade would be great, just take things one step further.
Yeah, we ended up screening practically everybody this year because we missed so many children in the previous 2 years. So
Can it be requested, like if you're having a reading trouble or something, could it be requested?
All the time,
like
yeah.
to, okay.
Yeah.
That's
if a
good.
teacher notices the child's having some difficulty or, rubbing his eyes, scratching it, or whatever, they just think that they're not getting it, we'd be happy to do it.
Great.
But that's now. We do that now anyway.
Yeah, I mean, that's right in the policy, was that for
That's right.
this list of reasons, you can make anybody can make a referral to the nurse, and the nurse will do a test. Now we can do this, so.
Yeah.
So we are using it now in the schools, or the plan is to use it?
We've already done our screening for this year,
Okay.
so we'll start it in the fall.
No, but like if someone makes a request tomorrow and says,
Oh.
I don't like, will we use it, or we're still
If you
using
guys
it?
vote on it tonight,
I-
yes.
If the
So
policy is approved.
What about for the children that already have vision correction in some way? I believe when my son had his done this year, it was done with his glasses on, and the nurse let us know that he still had deficiencies, which we know about because we're still seeing ophthalmology.
Yeah.
But it was done with his lenses on, which wouldn't be the case with this. So how are you gonna handle those children?
That's right. So what we would do, we would still screen those children. We're going to screen everybody now, which we always have, but without their glasses, and then give what we are reading, give the reading, and it will give you what the prescription should be. And if they don't match, then you can just bring that information to your physician, eye doctor, and get it corrected that way. Because sometimes, you don't see, children don't get to their eye doctors for a year, and a correction could be made sooner than that.
Right. All the more reason to do second graders.
Sorry?
All the more reason to do second
There
graders.
you go, yeah. Okay?
All right, so, just in consideration of the policy, I don't know if people want to take time to review it, or if you're fine with the changes that were made, and if so, we're happy to wait and have you get a chance to review it or approve it tonight.
I think, this is fantastic, equipment, a great program. I would say that we can vote on it now, if anybody has any reason not to.
Support it, sounds fine. The only thing he mentioned was that, but is that something that you can't really modify, the second grade piece that you were bringing up?
Right, can we amend it?
We can amend it
that, or-
right now, yeah.
Okay. To just include that if there's that issue with there isn't that physical or whatever you mentioned that covered it in that particular year? So is that what the issue was that it omitted second grade because previously there was some other physical
Yeah,
that?
but I'm saying 10 years ago.
Oh, okay.
Right,
So
So
then
it hasn't been done.
So then we should put in two.
So,
Yeah, so we could add two just into section 4, students to be screened.
Okay,
we'll
everybody in
add
favor
second
of
grade
making
there.
that change?
okay.
Any opposed to making that change?
So we need a motion and a second and a vote.
Okay, so motion to make the amendment for a second, you mean for the second?
To the policy as
the
amended,
policy, the
as amended with the second grade
The
option.
second grade option.
And I'll second that. And so, all in favor?
Aye.
Any
And
opposed?
it's just motion to approve the policy with the amendment
So
now.
now, we've approved the amendment to the policy. Now it can.
Well, I thought we voted on the policy
On the
as
pol-
amended with the second grade
Oh,
option,
okay.
with the
Yeah,
second
okay.
grade screening added.
Perfect.
Was the intent of what I.
Okay.
I
what I-
think we did that backwards, it should have been a
Yeah.
second order amendment, but I think we could.
Well, you propose the amendment, then, or the change to the policy, then you
Right.
make the amendment, but
Okay.
I think,
Okay.
we're close.
I think we got it.
But,
So I'll make
Yeah.
those
I
changes
don't
and
think anybody
then
will fight.
Andrew, you can send them out with the minutes. Would that be appropriate?
yeah, I mean, that'll be noted in there that the policy was approved with the addition of screening second
Okay,
grade
great.
students.
Look at that, that was beautiful. Woo!
Hey.
There are fingerprints on the screen. I'm getting upset.
Any other comments? Any other comments about anything we discussed? So can I have a motion to adjourn?
So moved.
Thank you.
All in
Thanks, everybody.
favor?
All in favor, yes. Thank you.
All right, good night, everyone.
Is
Good night, Mary Frances.
adjourned.
Bye,
Night.
bye, thank you.
Bye, everyone.
See you, Henry.
Good
Bye.
night.